Amanda Roberson shows us how to keep your children safe and what to do if a child does get burned.
Only about 3% of traffic that comes through emergency rooms in East Texas is related to burns, and only a small portion of those patients are children. But surgeons say even that low number can end in tragedy. Protecting children, it's a burning issue.
Mama had that. It's her right there. Mama burned it on.
3-year-old Evan Loghry had a near miss with a hot pan, but his mom Jessica took the burn for him.
I didn't burn my own.
In fact, neither Evan nor his 2-year-old brother Seth have ever been burned.
I think I'm really paranoid. I have the water heater child-proofed. I have it turned down low enough to where if they get the water all the way hot, it's gonna be uncomfortable, but it's not going to hurt them.
Jessica's a single mom and takes every step she can to keep her kids burn-free.
Where are you supposed to be when Mama cooks?
In there.
They're not allowed in the kitchen while she cooks, and sunscreen is the rule outdoors.
This one is so pale, I'm so afraid, and I don't like sunscreen. I apply it every 5 minutes, it seems, if I have him outside at all, because he just gets so red so fast.
Sunlight's great. We need it because in order to develop vitamin D, we have to have that interaction with the skin. What you don't need is burns.
Dr. Luis Fernandez is the head of trauma at Trinity Mother Francis Hospital. He says parents need to be sensitive to heat because of their kids' sensitive skin.
On the extremes of ages, and very old and very young, the skin begins to thin out. It starts thin and then it ends up thin. And so what could be a 2nd-degree burn for you and I could actually be a 3rd-degree burn on those 2 extremes of ages, particularly in children and in toddlers.
But 1st, 2nd, 3rd-degree burns, what does it all mean? Well, think of it like this. 1st-degree burns are a sunburn, red and painful. 2nd-degree burns, the skin bubbles and blisters, causing even more pain. 3rd-degree burns look like leather. The skin is charred and so are the nerves, so you don't feel much, if anything. And 4th-degree burns go to the bone, killing everything and leaving you feeling nothing.
That's not a good thing. When I walk into a trauma bay and I see a patient screaming in agony from a burn, his odds of survival are great.
But even the most minor burns come with consequences, like increasing chance of skin cancer.
When you burn the skin is basically protein. It shrinks. It becomes less elastic, so you have limitations in functionality. On top of that, you also have cosmetic defects.
Burns are pretty permanent. They can, especially for a young kid.
Permanent on the body and mind. And for Evan, it's a burning issue he wants no part of.
I get hurt.
You don't want one, do you?
No, I don't want one.
So what if your kid does get burned? A lot of us think cool water or a package of frozen peas is the way to go, but doctors say don't do it. First, safely remove your child or whoever it is from the burn environment. Then doctors say call 911. Professional help is always best. And third, again, don't apply anything cold to the skin. Justin and Jillian, doctors say adding the shock of cold to a burn zaps the burn victim's natural body heat, taking away their ability to create enzymes that can fight off infection. Back to you.
Common mistake a lot of people make.
That's right, and they can be so dangerous, but if you get one, again, you can apply some gauze, maybe a light handkerchief, something that's not going to really be heavy on your skin. Here's the gauze right here, and then also some burn gel, which we have here as well.
Yep,
just a little bit of that, a little bit of this, take some of the pain away, and then get some good medical help to take care of that.
You can usually find this in like a first aid kit,
right?
So we can find that burn gel. And experts also say talk to your children at a very young age about the dangers of heat.